Maddie, Olivia, and I are going to be talking about oral pathologies in the mouth. And the first one we're going to talk about is hormonal disturbances, which may include pregnancy gingivitis, which is inflamed gum tissue. And as you can see, there's like a red line above the teeth, and that's what pregnancy gingivitis is. It's caused by the hormonal changes that increase the blood flow to the gums, and it causes the gums to be more sensitive, irritable, and swollen. To prevent this from happening, you can use an anti-gingivitis toothpaste and mouthwash. It occurs in about 5% of pregnant women, and this condition will clear up after the hormonal balance returns to normal. Another one is pyogenic granuloma. It is a pregnancy tumor, but it is also found in males and non-pregnant females. It is the most common of all of the tumor-like growths, and it is a reaction of connective tissue in response to local irritants. It's frequently located around the anterior teeth, and the lesion does not contain any pus. It occurs mostly around the mucosa of females with high levels of steroid hormones, which is why it's more frequent during pregnancy. The treatment of choice is surgical excision, and poor hygiene may be a factor of this. It may grow back, and calculus should be removed to eliminate irritation. And the next one is puberty gingival enlargement. It is inflamed gum tissue, and adolescents can experience this, both male and females. Gingival tissue becomes enlarged, bleeds, and appears soft and swollen, and it appears in areas of plaque accumulation, and it corrects itself after hormonal balance is stable. And it is more common in girls than in boys. Next, we're going to be talking about developmental disturbances. Amelogenesis is genetic. It is discolored enamel, missing or thin, and it is treated with composite restorations. It is more susceptible to caries because of lack of protection from the enamel. Ankylosis is the fusion of tooth, cementum, or dentin to the alveolar bone. It appears below normal occlusal plane. If this affects a third molar, it becomes difficult to extract, and you may have to use a handpiece.
Next, we have anodontia, which is congenitally missing teeth. This is most seen in permanent third molars, which is also one of the most common anomalies for third molars. Dentinogenesis imperfecta is a hereditary disorder, and basically the enamel appears opalescent, which is almost like a faded look or almost see-through. It kind of appears as a blue-gray or a yellowish brown, which looks just worn away. This leads to a lot of chips in the dentin. It's just a lot of weakening in the dentin, also in the pulp. Sometimes pulp chambers can be missing along with root canals, which obviously just leads to a lot of problems with no strength of the tooth. So a lot of times it'll be replaced with a denture or with implant depending on the health of the bone, but a lot of times crowns aren't really an option because of the weakened tooth. Next we have fusion. This is just when enamel and dentin of two or more individual teeth join together. It's mostly seen in mandibular anterior deciduous teeth, and basically the difference between fusion and, I'll go to our next one here, gemination, is that fusion is two separate teeth, and then gemination is when one tooth bud tries to divide into two different teeth. So fusion is two teeth joining together, and gemination is one tooth trying to split apart. And the indentation appears very prominently on the incisal or occlusal surfaces with gemination. Next, we have twinning, which is basically just when when gemination is successful, and two separate teeth are basically made just from one tooth bud. Next, we have macrodontia and microdontia. We know macro means big, micro means small from like our macrofill, microfill. Same concept here. Macrodontia is just abnormally large teeth, and microdontia is abnormally small teeth. And we learned that a lot of times microdontia is seen in patients who also have Down syndrome. Next, we have neonatal teeth, which basically just is exactly what it sounds like. Teeth that are present when a baby is born, and these teeth fall out very quickly after birth and are not present for long, so it doesn't really lead to too many issues. Next, we have supernumerary teeth, which are extra teeth, most frequently found in any maxillary anterior teeth, and then also can be in maxillary or mandibular third molars. I know that we've talked about having like a second third molar before, and that can be a common anomaly for third molars as well. And then they also are dwarfed in size and shape, but in normal anatomy, it's pretty similar to whatever tooth it's mirroring, whether that is an anterior tooth or a third molar.
And then we have oral tori, and this is bony undergrowths of tissue in the oral cavity. It's normally seen in the midline, but it can occur on the lateral border. This makes it difficult to take x-rays as we can't fit the sensor in the mouth properly because it's painful. Then you have exocytosis, and then this is an enlargement or nodular growth on the dense lamina of the bone. And as you can see on the picture, it's on the facial side. There's no treatment, and it's only if there's dental appliances that are needed that we would try and do something about them. And then you have photocyst spots, and 80% of the population have this. And as you can see by the picture on the right here, there's yellow spots that occur, often on the buccal mucosa. There's no causes or treatment that we have so far that we know of. And then you have a fissured tongue, and there's only 5% of the population who have this. And as you can see by the picture, it looks painful. It just wrinkled deep grooves on the tongue on the surface. And then you have a bifid tongue, and as you can see by the picture, your tongue actually isn't just one shape. It's kind of got that little middle part there. It's two lateral halves of the anterior 2/3 of the tongue that fail to fuse completely. And then you have ankylosglossia, and this is the lingual frenulum, and it's attached to the tip of the tongue, so it's also known as tongue-tied. The DA can also check for this when anesthesia is administered. And then you have nutrial disturbances, and this is going to be your angulocheilitis and glossitis. So angular cheilitis, it causes red or inflamed patches on the corners of your mouth. It can last a few days, or it can just be chronic. And it's when you lick your lips a lot, and that saliva gets built up and it's trapped there. So it creates a warm, moist environment where fungus like yeast can grow. So the symptoms include bleeding, redness, swelling, or painful. And I put a picture here, so a cold sore looks more like a blister, and then these angular cheilitis kind of look more like, I don't know, like a zit that you pick out almost, that's trying to heal. It can be in all kinds of ages, so infants to adults. Other symptoms include feeling itchy, blistering, burning feelings on the lips, or difficult to eat as it kind of hurts the sides of your mouth to open, and that it's different than a cold sore. Glossitis is inflammation of the tongue. It causes it to swell and change color. As you can see in the two pictures below, there's 3 different types. I only found 2 pictures that really show well of the glossitis and the atrophic. So there's acute, chronic, or atrophic. And glossitis is caused by allergic reactions, diabetes, low iron levels, or mouth trauma. And the symptoms include inflammation, inability to speak, eat, or it's painful. So acute glossitis appears suddenly and is often severe. It usually happens with an allergic reaction. Chronic is when the issue continues to reoccur and often leads you to other medical issues. Atrophic is when the papillae is completely lost, so you can see how the tongue looks completely smooth. People who are at risk for this are people who eat spicy foods, wear braces or dentures, or have herpes or an immune system disorder. And then there's our sources cited page.